Imagine holding a single strand of hair, thin, delicate, almost invisible in the light. Now imagine a surgeon holding a needle and stitching together a blood vessel even thinner than that. It sounds impossible, but it's one of the most advanced skills in modern medicine: microsurgical vascular repair. Microsurgery is surgery performed on an incredibly small scale, where every move happens on structures just fractions of a millimeter wide. To make this possible, surgeons use high-powered operating microscopes, magnifying the surgical field by 10, 20, even 40 times, turning hair-thin blood vessels into something that looks as thick as a pencil in their view. Why is this necessary? When a finger, hand, or other body part is severed in an accident, simply sewing the skin shut won't save it. Without restored blood flow, the tissue will die within hours. That's why surgeons must reconnect both arteries, which carry oxygen-rich blood to the tissue, and veins, which bring blood back to the heart. These vessels often measure just 0.5 to 2 millimeters across, sometimes even smaller than human hair. To do this, they use microneedles only about 80 microns thick, 4 times thinner than a human hair, and nearly invisible sutures made of ultra-strong nylon or proline, sometimes only a few microns in diameter. One misplaced stitch, or even a tiny variation in tension, can cause the vessel to clot or bleed uncontrollably. The skill required is extraordinary. Microsurgeons train for thousands of hours, practicing on synthetic vessel models or on tiny animal vessels, like those of rats or chickens, to master perfect precision. They learn to control scalpels, forceps, and needles while looking through a microscope, meaning every hand movement is magnified, and even the slightest tremor feels like a huge jolt in the surgical field. Operating rooms for these procedures are kept cool to maintain the surgeon's focus during operations that can last many hours. They work under intense, cold lighting, with a whole team monitoring microcirculation, administering fluids, preventing blood clots, and tracking the patient's vital signs in real time. Thanks to these techniques, tens of thousands of limb reattachments, skin grafts, and even full face transplants have succeeded worldwide. A study in the Journal of Plastic and Reconstructive Surgery reports survival rates above 90% when patients reach the hospital within the golden window, typically under 6 hours after injury. And now, cutting-edge robot-assisted microsurgery is pushing the limits even further. Surgical robots can virtually eliminate hand tremors, allowing the repair of vessels as small as 0.3 millimeters. Some systems have already been tested successfully in Europe and the United States, and could become standard practice in the next decade. In simple terms, vascular microsurgery is the art of combining science, technology, and unmatched human skill. Here, every stitch is not just a medical act, it's a fragile bridge between life and death.